Uh, Hi, I'm Howard Lux.
I'm Jeff Berg.
We are the two boneheads, bringing you an extraordinary amount of orthopedic experience at your service. Today, we're going to talk about AC separations. The AC joint is the joint on top of your shoulder. It is the joint formed by the clavicle and a part of the scapula. AC separations can occur from a contact injury. Is there a specific way that the contact occurs, Jeff?
Yeah, well, probably the most common mechanism, I think, is just falling on the point of your shoulder right up on top. I see them a lot with three mechanisms typically. One is bikers falling off their bike. Two is quarterbacks getting jammed into the turf on a sack. And then I'll see it in hockey players getting smacked into the boards. And typically it's pretty classic, just acute, really painful right on top of the shoulder where you pointed to.
Right. So sometimes you'll notice a bump there. As Jeff just mentioned, you'll always have really severe pain, but you don't have to have a bump to have a severe injury. Just a grade 1 injury where the ligaments are strained hurts. How do we grade these injuries? How do we assess these injuries and look at them?
Yeah, so for me, it's clinical and x-rays. I don't really need much in advanced images like MRIs or CTs for most of them. And what we're really looking at is amount of displacement. And typically they're graded anywhere from 1 to 6, but for the most part, at least in my eyes, you really have three kinds. You got those without deformity, those with deformity that don't need surgery, and those that have deformity that you might consider surgery. And there's those three groups.
Right.
I treat most of them. I mean, the great majority of them, Howard, as you know, don't need any surgery, and we can treat them similarly to how we treat an ankle.
Agreed. So the grade 1 and grade 2s have almost no deformity. You might notice a little swelling there in a grade 2. The grade 3 is where you start to see the deformity, and you see your clavicle. It looks like the clavicle is popping up. In actuality, your shoulder's sagging down. And the grade 5s, the clavicle looks like it's up by your ear. So I think you would agree that grade 5 injuries, the more severe ones, we tend to operate on.
Absolutely. Yeah, I think that for me, like the greatest problems I see in them is for most, like we said, most AC sprains, they'll get better 4 or 6 weeks, depending on the age of the person, activity level. But those that are really displaced, sometimes what will happen, I find, is one of two things. Either they have a pretty significant cosmetic deformity that's really disturbing to most people, or they tend to get instability where that end of that clavicle pops up and it hits on that acromion, and that's really problematic for patients. Right. Those have to be fixed.
That I agree with, and you bring up a great point. We're subdividing these grade 3s now. You know, we used to say in our world, the pendulum has swung for us a lot as we've been in practice to operate on, to don't operate on any grade 3s, operate on all grade 3s. And now it's, well, maybe there's some stable 3s and some unstable 3s.
Right.
So exactly as you said, if there's an unstable 3, then they're going to need surgery.
Now, let me ask you, so for me, it's really hard to tell acutely instability or stability. So
exactly.
So I don't know how you treat them, but what I tend to do is I find, at least when I'm treating patients, I don't notice that there's a difference if I operate late or I operate early. So if there's not a lot of importance to the patient from a cosmetic standpoint or some social issues to operate early, I'll usually on those grade 3s just treat them like any other one, see how they do. And if I'm starting to sense as that swelling comes down and their motion and function comes back, that they're complaining of a clicking or a popping there, then, you know, that may be the time to surgery.
I agree completely. What do we do with these grade 1 and grade 2 injuries? You know, so Junior is 16 years old and he falls onto his shoulder. He has a grade 1 or grade 2 AC separation. When can that child or athlete expect to go back, and do we risk further injury if we let them go back too soon?
Yeah. So, well, you know, I don't know if we risk further injury. I don't treat it as if we do. I treat it like an ankle sprain. I think in most cases people can go back. There are some thoughts that on some of those grade 2s where you have just a little bit of displacement, those patients might get some early arthritis in that joint. But I don't know that I see that. So in a younger person, I find it, boy, like if it's a teenager or younger, by 2 weeks, those patients
Ready to go back.
Good. Now that doesn't mean they can go back to contact activities. They may not have good strength or range of motion. So I'm usually looking at when that person has full strength, full range of motion, no pain, and I think they're okay to get back to contact activities. They can shoot a basketball or throw a ball sooner when they feel up to it.
Agreed. So the controversy exists in these grade 3 injuries, folks, stable versus non-stable. Wait a while to determine if, in fact, you are unstable. Don't rush into anything. Grade 5s, we agree, likely a good candidate for surgery to get that clavicle out of your ear. And we'll talk to you next time. Bye.
Bye.